So if we're looking at holistic versus conventional. So what is conventional? If you were diagnosed with CFCs and you went and followed the rules, they would have surgery, chemotherapy, radiation therapy, what they call oncoimmunology or immuno-oncology, immunotherapy, and then there's some like dendritic cell vaccines and other kinds of vaccines. It's basically that. So what are the outcomes? So we look at all the research from peer-reviewed oncology journals, and we see that the research shows that the outcome is not that good. You'd be surprised. There was a study came out in 2005 looking at the contribution to healing from CFCs with chemotherapy. And it was pretty tragic because they look at multiple clinical trials and studies, right? And they take all the information and they distill it out and they come up with an idea from all of it, all of the different clinical trials. So they did this in both Australia and the United States, and the conclusion was if you had stage 4 CFCs and you went into the hospital. In the US, you had a 2.1% chance of being alive in 5 years. In Australia, you had a 2.3% chance of being alive in 5 years. That means greater than 97% chance of not being alive. That's not what you want. You're certainly not going to get on a plane that has a 97% chance of crashing. So that's what is chemotherapy? What do all these things do? What does surgery do? Now, are they ever necessary? Absolutely, they're necessary for certain situations. What are the outcomes and all that? And outcomes, I don't mean just 5-year survival. I mean 10, 15, 20. I mean, we're talking about, are you back to normal? That's what I want to know. Are you back to normal? And what I want to know is, are you eating? Are you enjoying your food? Are you able to get a good sleep? Are you having fun with your friends? Are you laughing? Are you able to do work? Do you have energy? Because it's not just being alive and hooked up to some machine. You want to be living. Then we look at holistic. What is holistic? Well, holistic should mean, it should be spelled with a W and not H. The holistic, whole. You're looking at the whole being, You're looking at the mind, the psyche. For example, I've seen this clinically. If you're full of fear, there's no way. And if we don't deal with that, there's no way you'll heal. You can't, because the fear directly suppresses immune function. We know that. So we've got to work with that. So that's holistic. We also know that there are many, many healing disciplines, medical disciplines, and not one of them has all the answers, right? So you've got traditional Chinese medicine, you've got Ayurvedic medicine, you've got naturopathic medicines, you've got chiropractic, you have osteopathy, and then allopaths with MDs. For example, if you got a baby coming out foot first, you don't go to the herbalist. If you just broke your femur, your leg, again, you don't go to the herbalist. Right? So you're going to know when to use what. But if you have a chronic illness like what they're calling diabetes or what they're calling arthritis, and if you go to the hospitals, they're going to give you poisons that aren't going to maybe hide the symptoms. But if you had diabetes the day you walked in, if 30 years later you still have it. So we got to know when to use what. The physician or clinician who's going to be kind of like the captain of your journey has got to know what is it that conventional medicine does. What is it? Do we know it? Do we understand it thoroughly? Were we trained in it? Yes. We need to know that. Because we need to know when to use. And do we know about the others? And yes, we have to know about those and have training in it. So if you have training and knowledge in both of them, you can say, aha, here, we'll do this. You'll know what to do. So holistic is incorporating the best of all medical disciplines, all healing disciplines, in the proper order, and knowing when to use what. So for example, there's a tumor in the brain that's growing rapidly. Okay, we've got to do radiation. We could do surgery, radiation. If there's a tumor on the spine and it's about to make someone paralyzed or causing excruciating pain, we've got to do radiation. If there's a tumor starting to block the colon and you won't be able to have bowel movements, you got extreme pain, we've got to do surgery. However, there's a little lump on the breast, what happens? And we do surgery. Well, we take it out and we spread it, and then if we do chemo, we just make it worse. So there are times to do it, times not to do it, and you have to know when. So that's holistic. Basically, the difference is the conventional uses just specific modalities. They're based on the disease model, which means they got to kill that disease. We're going to get rid of it. We're going to us against them. Whereas the holistic model is saying we want to restore balance. We want to restore harmony so that for someone to achieve health. And health is our goal, not to get rid of something, but to have health. Because once you've arrived into the land of health, Not only do you not have CFCs, you don't have high blood pressure, you don't have diabetes, you don't have depression. That's health. That's where we're going. I mean, if you got rid of your CFCs, but you had a stage 4 heart failure, that's no fun. Or crippling arthritis, that's no fun. So the goal is not to get rid of any of the different various manifestations of a toxic and depressed and stressed being, but to be restored to health, to bring everything back into balance. That's the goal. That's the difference. And I teach by, I'm going to show you how it's true. I'm going to show you that I read it. Here's the studies. Look at it and give you a copy. Read it. Go home. Read it. You need to know it's okay. You need to know it's okay. Not me. You don't believe me. In fact, don't ever believe another doctor the rest of your life. If any doctor tells you whatever, say, thank you very much, doctor. I appreciate your opinion. Now, could you please share with me the research that you've read that allowed you to come to that opinion? It's a fair question. No, I'll always do that. You got to hear me say it and then see that. Oh wow, all those stuff. Oh yeah, okay. Now it's yours. You own it. I want you to own it. And by the way, our goal, is that you will never need another physician the rest of your life.